the follow-up question I have is what about like range of motion and mobility? Because if you're targeting that older demographic, that is really important. It's a really important component of their health and fitness. So how does ARX address that?
Well, I think the biggest way we address it starting off is that you can ease into it, if you will, in terms of just getting your feet wet. Sometimes if we're taking somebody who is, let's say, 75 years old, hasn't worked out maybe in their whole life, but the doctor's on them now about osteopenia, osteoporosis, it's more of a medical concern at this point. I think one of our customers was telling me the other day that over 50% of all deaths over the age of 60 are fall related, meaning complications from breaking a hip, infection that they might get at the hospital while trying to get help. That to me was just a crazy statistic. And it when we look at that and we say, for us, we're always going to have customers where it's like, if you want to get shredded and you want to do some fasting and you're tight on your diet and you're going to hit ARX really hard a couple times a week, you just want to look great at the beach this summer with your shirt off. Awesome. I mean, we're going to help you with that. That's great. But where we're going to change the world is helping those people who are either already hurt and now they need a safe way to kind of re-enter that fitness world that is effectively off limits for them in many cases with traditional equipment. So it helps kind of bring people under the tent, if you will. It broadens out the audience that could use it. And really, those are the people who need it the most. If you're, women, unfortunately, it hits earlier than men when it comes to the bone health, and when you got to start paying attention to that. And most people, a lot of doctors, even if you tell them you can grow more bone, that sounds insane. And the reason that sounds crazy is because the stimulus needed to create that adaptation is so high that you couldn't safely do it with traditional equipment. But we've got men and women of all ages, coming in and doing a leg press or a deadlift. We're teaching them, proper mechanics, but you're doing it with no weights involved. And so a lot of people, when they get hurt, it's because, think of like one of the more vulnerable exercises, an overhead press with dumbbells, and you've got all this rotation in the shoulder. There's so many. That doesn't mean that you can't do an overhead press and not get hurt. Of course you can. People have been doing it for hundreds of years, but it does significantly increase the likelihood of an injury because it's a very vulnerable movement. It's a difficult one. Same thing with deadlifting, and yet when you think about inch for inch in terms of effectiveness, or from a lifestyle perspective, I can't really think of anything more effective than a traditional deadlift. The entire posterior chain, where people are the weakest, and that's where a lot of those injuries come from. Problem is, teaching somebody how to do a proper deadlift, as you know, is challenging by itself. But then you really exacerbate that challenge by also now having traditional weights that are going to be underloaded for most of the movement, but then close to overloaded at certain parts of it when you're first picking the weight up. So really, that's where my passion's at, is taking people like my parents who are in their late 60s right now. They can come in once or twice a week, get everything they need in 15 minutes, and that's being quite generous. Our average workout is like 6 to 7.5 minutes, and that's all they need. Now, my folks are long past the days of doing it from a vanity perspective. They do it because they want to live. They want to feel good. They want to be able to pick the grandkids up and throw them around. And that is really where we are changing what the demographic looks like. We're just broadening that audience and bringing the people in who really need it. And for a
Um,
lot of people, we might just start with a static. We can program the equipment to not move at all. So we'll start with just a static press, and they can see their strength changing over time. So if you've got somebody who's recovering from an injury, or just starting from a place of no experience whatsoever, no baseline, we might just start them there, in particular because you also don't want them to be so sore that they look at it and go, I don't ever want to do that again. And if you go, all out on ARX the first time and you haven't, worked out in years, your chances are you're going to be pretty sore. But so
yeah.
we can bring those people along. And yeah, that range of motion, we just ask them, hey, do you have any flexibility issues in your hips or in your knees, or, any injuries we need to be aware of? And And if there is, then we just tighten the range of motion. Don't let them go that far. Because realistically, getting the full, like a leg press, for example, uh, the medicine that you want, so to speak, you're going to get, the vast majority of the dose, whether you're going, this far or just this far. You are firing those muscle fibers. You are creating that stimulus. Even if you're just doing a static press, you're gonna create a huge stimulus. So we don't really worry about that. We just make sure we know about any existing injuries and then set the ranges of motion accordingly.
I know, especially if you're talking on an older demographic, you're going to be dealing with injuries, and along with injuries come asymmetries. I know, like for me, I tore my tricep, and trying to rehab that, I mean, it's so dramatically weaker than the other side. So, how does ARX address those types of asymmetries?
Yeah, and that's probably what makes the equipment so exciting in our physical therapy customers, is that they're able to do single leg work where they can take a baseline on like a rehabilitating a knee, for example, on a leg press. They can see what the capability is the non-injured leg, and then compare it with the injured side, so we know where we're trying to get to roughly. And the beauty again of recovering from an injury on ARX is that your brain is this incredible governor. And barring any exogenous substances, you're not going to be able to really override the governor in your brain. It knows how much you can do. The problem is when you're rehabbing something, if you're picking a weight, you're always sort of conflicted by like, well, I know what I used to be able to do, and I know what I can do on the good side. So maybe I'll do half of that. You're just guessing. You're just trying to figure it out. With ARX, it doesn't matter if it's the first day you're cleared for exercise or a year or two post rehab. You're going to give it everything you can give it on that injured side, just like you would on the uninjured side. And your brain's not going to let you do more than you're capable of at any point during that rehab. So the ability to be able to give maximal effort or near maximal effort, even on an injured joint or muscle or whatever it is, you're going to be able to work your way back to normal much faster and without the risk of re-injuring, which oftentimes that's the thing that really sets people down. They come back a little too soon, they
Mm-hmm.
start going a little too hard, they picked a weight that was a little too much, now they're hurt again, and so now you start the cycle all over.